Welcome to Cloud on Air, live webinars from Google Cloud. We are hosting webinars every Tuesday. My name is Angela Gause, and today we're here to talk about connected healthcare, enabling secure entry points into the cloud with Chrome. You can ask questions anytime on the platform, and we'll have Googlers on standby waiting to answer them. So let's get started. Google's mission is to organize the world's information and make it universally accessible and useful. Within healthcare, and what we shared this year at HIMSS 18 is that Google Cloud's goal is very much a reflection of Google's overall mission. Applying this mission to healthcare means using open standards to help enable data sharing and interactive collaboration, while also providing a secure platform. To kick things off today, here's a brief video to illustrate what that might look like.
In business, there are a lot of moving parts. Google Cloud helps you connect the dots. Use Chromebooks with G Suite to make communication more open and productive. Access real-time data from Google Cloud Platform. Keep inventory up to date automatically. Add smart chips to your valuable products to monitor location and conditions in real time. Get instant updates from deskless workers out in the field. Reduce costs, improve efficiency, and ensure security with remote device management. Streamline operations and stay in control with connected tools and services from Google Cloud.
Excellent. So where you sit in the ecosystem, be it a care provider, researcher, supporting staff, or healthcare decision maker, technology is changing the way healthcare is delivered. Common priorities for digital innovation among healthcare systems, hospitals, and care facilities include improving the wellness of a community through improved access to patient care, be it retail clinic, telehealth, home monitoring, or other virtual healthcare option. Reducing the cost and complexity of IT and increasing agility, particularly in the face of budget and funding uncertainties. Supporting new healthcare business models by providing anytime, anywhere access to patient information via remote and multi-channel access to mobile and web applications. Strengthening protection and defense of PHI and other sensitive health details by leveraging information security in the face of new and more sophisticated cyber threats. Improving the quality of patient services and business decisions through more and better use of big data analytics and IoT. 4 key trends transforming the industry and driving the needs for those priorities are as follows. The ongoing need to reduce costs in the delivery of care. Healthcare systems around the world are struggling to deliver satisfactory care in the face of budget cuts and increasing demands from an aging and growing global population. Workplace challenges contributing to this need are the time and staff shortages. As physicians are pressured to deliver an increasing number of preventative services, follow guidelines, engage in evidence-based practice, and deliver patient-centered care in managerially driven organizations, they struggle with how much control they have over their own time. According to the biannual physician survey, only 14% believe they have the time they need to provide the highest standards of care. Additionally, the current worldwide shortage of physicians, nurses, and other health workers is 7 million, and the gap is widening. Some doctors are looking to leave the profession amid burnout and low morale due to regulatory and paperwork burdens and a loss of clinical autonomy, according to the World Health Organization. Training can also be a factor. The BGL Group reports that approximately 40% of employees who receive poor job training are likely to leave their positions within the first year. The second trend transforming the industry is the increasing threat of cyber attacks and data loss. With growing concerns about cybersecurity and the loss of sensitive information, this is changing, and the risk of not overhauling and moving forward with new viable technology solutions is becoming the greater threat. The Ponemon Institute estimated an average breach cost of $3.5 million in 2017, with a 27% probability that a U.S. company would experience a breach in the next 24 months, costing between $1.1 and $3.8 million. If you multiply that estimate per record cost for a breach across the industry, multiple breaches combined would potentially cost hundreds of millions of dollars. The third key trend driving transformation in healthcare is higher service expectations from digitally savvy patients. Today's digitally savvy patients expect on-demand, personalized service. Digitalization and the implementation of mobile strategies can no longer be approached as an afterthought in the delivery of care and patient experience. Mobile is becoming ubiquitous in healthcare, playing a significant role as the industry continues to adopt a patient-centered approach. Healthcare leaders are now seeking to improve the patient experience through tailoring patient engagement strategies to meet the expectations of their digitally savvy patients. One example of this is the proliferation of mobile devices in healthcare, as it helps to reduce paperwork time by 60% and increase patient face time by 29%. And the fourth key trend driving transformation in healthcare is advancing disease prediction and prevention through insights and machine learning. From high-end diagnostic imaging systems that let doctors catch deadly diseases like cancer in their early stages, to voice recognition systems in the operating room, which help doctors get a better view of parts of the body while operating, technology has made life easier for both doctors and patients. However, although AI is a hot healthcare topic, some haven't felt ready, meaning it still needs to be translated into reality, especially in an industry as complex as healthcare. Among the challenges to widespread use are the acceptance of AI applications in clinical practice, difficulty leveraging divergent personal network devices and AI solutions, and access to quality training data on AI applications and health and gaps in data streams. As healthcare moves beyond the walls of the hospital, so healthcare IT must move beyond the data center. The need to adopt digital tools and develop new strategies to change the way care is delivered to patients and residents may seem obvious, but the care industry sometimes lags behind others in its use of technology. It's not that healthcare providers don't want to try new innovative tools to support better models, but the risk of failure has often been deemed too high. The implementation of cloud strategies and digitalization can no longer be approached as an afterthought in the delivery of care and patient experience. It will not only help meet the needs of today's digitally savvy patients, it also has the potential to impact every aspect of care delivery and operations, enabling more efficient utilization of resources, more time with patients at the point of care, and a more secure and governed working model. Like it has in other industries and commercial enterprises, cloud-based technology will play a pivotal role in overhauling health and social care environments, providing care professionals with secure mobile access to information and resources at the point of delivery, and opening up new ways to collaborate and improve the quality of patient care. In a traditional computing model, you would bring data to the individual. Data sharing in that model essentially implies data copying. Costs can be high and unpredictable. There are burdens associated with installs, integrations, and upgrades. Data silos detract from insights and correlation, and software deployment can be inflexible. But in a cloud computing model, you bring individuals to the data. In this model, simplicity is king and users truly share data. Costs for services are predictable. The focus is on business value, not managing infrastructure. There is a comprehensive patient-centric view, and apps and compute can be done anywhere. Let's go back. Sorry about that. Google Cloud offers many tools within its enterprise portfolio to address healthcare's digital priorities and the trends driving digital transformation that we just discussed. With more than 1 billion users leveraging 7 of those products each month, the solutions range from storage and compute, machine learning and artificial intelligence, productivity and collaboration, to the platform that serves as a secure gateway to the cloud, Chrome Enterprise. Chrome Enterprise is a license you activate to centrally manage, enroll, deploy, monitor, and secure Chrome devices running Chrome OS. The Central Management Console offers a host of features to keep your organization safe and enable your end users to work smart, including access to enterprise app storefronts, deep security controls, 24/7 support, as well as integration with cloud and on-prem management tools. For your business, the platform is secure by design. The platform leverages comprehensive AI-driven threat detection and granular policies to protect your data and your users. Custom security protocols for individuals or groups of users, and you can easily provision, manage, and secure devices. Lost or stolen devices can be disabled within minutes. With over 200 security policies that may be applied to either the user or the device, granular and flexible controls enable centralized fleet management and updates. This ensures compliance of IT policies no matter which user is accessing a device or which device is being accessed by the end user. This drives value for your organization. Increase your employees' productivity by ensuring they spend less time waiting for new updates. Automatic managed updates take place in the background without getting in the way. And without those distractions that sometimes you find in a local platform, users can get more out of their day because it is simplified and centralized, resulting in a 63% lower administration cost overall. Then for the end user, the platform means secure application access. Whether it's a SaaS app, virtual desktop environment, or a favorite Android application available through Google Play for Enterprise, users have access to all of their data right from the Chrome launcher in the bottom left corner of the screen. The platform is built for the cloud worker. When you deploy Chrome to your care team, clinicians become untethered from local storage and are able to enter and access patient records quickly and collaborate with the extended team. And finally, while healthcare has a unique set of challenges to simultaneously deliver and protect PHI, workers still care about having the state-of-the-art devices and cool features to get the job done. With enterprise-grade hardware, the good news is we have both. In healthcare, security is a top concern. Chrome Enterprise extends comprehensive security with a multi-layered approach. Each Chrome device arrives encrypted out of the box through hardware-backed security and a TPM chip. Verified boot of Chrome OS uses the TPM chip to ensure integrity of the device and tell if the OS is genuine or not. Tab sandboxing means each web page and application runs in its own restricted environment, which prevents against attacks such as cross-site scripting. When run in ephemeral mode, browsing information is not left behind on a device because the profile is deleted immediately after the last browser window associated with the profile is closed. And with AI-driven threat detection, safe browsing reports over 1,000 instances of suspected malware every minute by showing users a warning message before they visit potentially dangerous sites or download a harmful app. And again, with AI-driven threat detection in Google Play Protect, all apps are automatically scanned for malware before and after you install them. Then, regular updates and patches round out this multi-layered approach. Chrome OS gets an update every 6 weeks, with security patches rolling out every 2 to 3 weeks. And on top of all of that, Google hosts a bug bounty program. Again, all of this happens in the background while an end user is at work, meaning disruptions are minimized and uptime is maximized. Once again, Chrome OS becomes ready for healthcare through the Chrome Enterprise license, which unlocks the central management console. The granular controls from the 200+ security policies allow you to customize and curate your end user's experience, be it in cloud worker or one device to one end user assignment mode, public session or many users to one device assignment, or kiosk mode, which extends a single app on a device or displays information through digital signage. The policies can be extended per user or per device based upon your existing end user segmentation. While the Chrome Enterprise Console provides a feature-rich solution, we also recognize the needs of healthcare to support overall clinical and business workflows, as well as legacy apps. With that in mind, Google has partnered with top UEM vendors such as VMware, Citrix, IBM, and Cisco to extend flexible EMM management options and integrate Chrome Enterprise seamlessly with your existing environment. We also offer IDP solutions, including Google Cloud Identity and Microsoft Active Directory, to easily define a wide range of criteria and control which types of websites, apps, and extensions can be accessed by users. From an end user perspective, again, workers care about having the state-of-the-art device with cool features and access to the apps they need to get their job done. A variety of form factors are available to match your needs, from traditional clamshell to convertible 2-in-1 with stylus, as well as Chrome boxes and Chrome bases. Hardware options include the latest Intel processor models with 8+ gigs of RAM, on-device storage, 10 hours of battery life, and various builds from entry to rugged to premium to suit your use case. Google works with top OEM vendors including Samsung, Lenovo, Acer, Asus, HP, and Dell, so you can continue working with your favorite brand or OEM of record. Combining the software, hardware, and management platform that we just discussed is how Chrome Enterprise enables the connected experience in healthcare for staff, back office administrators, and patients alike. Carers and patients have better access to information in real time. Reliance on outdated processes is removed as you integrate with legacy systems, and tech-savvy patients are served with premium devices. Let's take a moment to discuss each one in more detail. According to the Journal of Medical Health and Informatics, mobile devices can help reduce paperwork time by 60% and increase patient face time by 29%. Mobilize and connect healthcare staff with Chrome devices and empower them to deliver more seamless care experiences. Virtualization allows users to access customer clinical legacy applications and address data security. Leading VDI solutions from Citrix and VMware, as well as other providers, secure access to natively installed applications, and through the Chrome Enterprise Central Management Console, enrollment of the experience takes less than a minute. From a user perspective, free up healthcare professionals from fixed workstations and provide them with easy mobile access to the files and information they need on the go, meaning they can deliver the best care and achieve more in their day. Chrome OS is built fundamentally to reduce downtime for workers. Devices boot in under 10 seconds and come out of standby in under 3. Additionally, Chrome syncs apps, policies, and preferences across devices so that workers have continuity and can pick up from where they left off across multiple devices in a day, be it an exam room, hallway, medical cart, front desk, or if using a loaner device. And that same encrypted cloud profile, which follows one user across multiple devices, means that one device can be easily shared by multiple users while ensuring that their day is set by the policies that IT extends. Either way, if you're following the end user or following the device, all OS updates are happening in the background, meaning users never experience downtime due to update notifications. Then, with that same cloud-based profile, staff can easily communicate and coordinate a single, consistent care plan across a team with the adoption of G Suite. Moving along to our second use case, being the non-clinical or back office administration, according to Gartner and the US Department of Labor, the amount of time an average employee spends searching for documents per year is 400 hours. ESG predicts $1.97 million in savings and benefits over a 3-year period using Chrome Enterprise on Chromebooks, including 63% lower administration costs through improved operational efficiency. With a fast setup and intuitive UI, users can be productive in minutes with Chrome devices. By including cloud-enabled devices, information and files are readily accessible, allowing staff to move away from paper documents, reduce filing costs, and free up space in the office, in the same way that we discussed with the clinical use case. Chrome devices can replace or integrate with legacy systems by providing secure access to virtualized desktops and apps for back office administrators as well. Lost or stolen device? No problem. IT admins can shut down and wipe all devices on a network from a remote location, barring unauthorized access. Approximately 40% of employees who receive poor job training might leave their positions within the first year. You can improve onboarding and education opportunities with shared devices and cloud-based resources. Host training and instructional videos easily utilizing the familiar YouTube platform, or house custom training apps with managed Google Play and maintain control over app development. In shared device public session mode, any employee could securely access the data and resources they need on any company-controlled Chrome device at any location, providing a more time-efficient and convenient process to fit around staff. Here again, individual cloud profiles allow employees to sign in from any device and only access the data they're permitted to see. And for our last use case we'll examine today, patients are increasingly looking at healthcare options with a consumer-driven mindset. On-demand kiosks enable healthcare providers to build more opportunities for tech-driven self-service and autonomy, as well as reducing staff administration time and manual processes. With Chrome Enterprise, power interactive self-service stations that have a 61% lower device cost in kiosk mode compared to competitors. Through the central management console, you may deploy single or multiple apps through kiosk mode to ensure guests can only access the content you want them to see and remotely manage Chrome devices from anywhere to control a network of displays. When configured in enrollment type public session mode, all local user data is removed from the device at the end of each session, preventing unauthorized access from anyone else. This means that Chrome is an affordable, reliable, and flexible device platform that makes digital signage practical for one screen or 1,000. With Chrome, hospitals and clinics can easily deliver information and services in real time to streamline operations and enhance the patient and staff experience. On the patient side, use kiosks to improve patient well-being through digital signage and informative communications. Using distraction in clinical environments has been shown to reduce perceptions of pain, lower anxiety and stress, and benefit clinicians by creating a calmer environment for them to work, often resulting in quicker treatment times. Placing informative digital screens in waiting areas can help lower anxiety, alleviate frustration, and reduce the perceived wait time by 35%. In tandem with Google's CMS partners, create dynamic digital messaging to greet and communicate with patients via personalized messages. Secure public kiosks can provide shorter wait times and a better guest overall experience by streamlining the check-in process. And they can also enable patients to order and request assistance, securely browse the web, or stream content for entertainment. In summary, Chrome can help in many aspects of your healthcare organization, from clinical workflow to business operations. For care providers, Chrome's cloud-connected endpoint simplifies and secures access to critical apps. Reduced complexity and ease of use means more time caring for patients. Fast boot times means quicker access to clinical information. Long battery life means more flexibility and mobility. For the patient, Chrome provides personalized digital service and more access to information. And for businesses, healthcare organizations can save money, simplify their IT, and manage risk. To share an example of a current customer leveraging Google Cloud technologies in healthcare, Middlesex Hospital has embraced an innovative computing infrastructure. More than 3,000 employees throughout the healthcare network now count on G Suite, including calendaring, scheduling, email, instant messaging, and websites, and the browser that powers them, Chrome, to easily and powerfully collaborate with one another. The challenge they were facing was that their legacy solution was not fulfilling requirements needed to match their high patient satisfaction ratings. The solution, after moving to Chrome browser in 2010, the hospital began to use G Suite, seeing quick uptake from staff, and Chromebooks were then later adopted for training purposes to start, and then the footprint was expanded. The benefits? Massive cost savings on their software licensing costs. Legacy browsers and healthcare applications were still supported, including SSO, VDI, and their primary EHR, because Chromebooks allowed the hospital to virtualize essential clinical applications and support. So that's a wrap on connected endpoints in healthcare. Thank you for joining us today. Stay tuned for live Q&A. We will be back in less than a minute. Welcome back. Now we're going to take a look at the live Q&A that's come in from the audience today. So the first question is, how is Chrome Enterprise licensed? Chrome Enterprise is available in either an annual license or a perpetual license, and typically we would encourage a customer to start the conversation either with a member of my team or with their preferred reseller partner. Okay, what else? Does Chrome Enterprise require G Suite? While Chrome and G Suite work very well hand in hand, and we would say that one makes the other even more useful and productive, G Suite is not required to run Chrome. And it looks like on our next question, which is, can I access Office 365 on Chrome? The answer to that question, similar. Yes, you can access Office 365 through the Google Play app, which is available, again, through the console. So you can just install your Office productivity apps through the Google Play store. And then looks like we have another question. Can my clinical team use a proximity card to log in? Actually, yes. So this is very popular, and we get this question a lot in healthcare. In healthcare workflows, badge tap and go. I have a badge here at Google. A provider or a clinician would come in, they would badge tap in, and they would get into their session securely. We do offer badge tap and go with proximity cards through our partner HealthCast. And as we continue to expand our relationships with different manufacturers and healthcare organizations to make the solution even better for our customers, we hope to continue to partner and integrate more solutions that round out healthcare workflows. So it looks like that is the end of the Q&A. So with that said, thank you for watching. Our next Cloud Air will be on July 10th.